Good morning, it's Tamika Chambers, integrated nutrition health coach, lifestyle coach, and coach tutor for NCLEX candidates. Hey, so today is Thursday. I'm doing another priority question. As I mentioned about a week or so ago, I saw a post that someone said they had a problem with or issue with priority questions. And the biggest thing is strengthening our critical thinking skills, you guys. That's what you want to focus on, and that's what I try to do with my clients. I aim to do that, and also to dismantle myths, as well as to decrease the anxiety and intimidation that can come with priority questions. So here we go. After the respiratory therapist performs suctioning on a patient who is intubated, the nursing assistant measures vital signs for the patient. Which vital sign value should the nursing assistant report to the registered nurse immediately? So this is where this is like management of care. What are you going to tell that nursing assistant to report after the respiratory therapist has suctioned your patient? And so keywords here, I'm going to pull out. What are your keywords? You can pause and get your keywords. My keywords are suctioning, intubated, looking at vital signs, what to report to the registered nurse. Remember to include immediately. So are we wanting the nursing assistant to report a heart rate of 98 beats per minute after the patient's been suctioned? Respiratory rate of 24 breaths per minute, or blood pressure of 168 over 90 mercury, if you will. Our tympanic temperature of 101.4 Fahrenheit or 38.6 degrees Celsius. So you can go ahead and pause this and pick your answer. And then I'm just going to go through this. Now, we have to remember the patient was just suctioned, right? So what I usually tell my clients, because usually people will go to A or they'll go to B, and I usually encourage them to think about this. The patient was just suctioned. So what they'll often say is that 98 is high normal. What about 24? 24 is high normal too. Normal is what, 12 to 20. Blood pressure is a little elevated, high normal. They were just suctioned, but look at that tympanic temperature of 101.4. One of the things that we have to remember is that anytime there is a portal of entry, people are at risk for infection, especially our ventilated clients, right? Because bacteria loves to get in warm, moist area, and you start thinking about suctioning in lungs. And anytime you see a temperature of 101, I usually say that's a flag, right? We need to be asking, are they asking a question regarding infection control, etc.? So the answer, you probably guessed it, is D, the tympanic temperature. And as you can see, here are the rationales for it. And also, again, a threat to people that are mechanically ventilated, right? They can develop pneumonia or any other infections. All the other vital signs are pretty much kind of high normal and is expected after putting that pressure on them. Think about that. So here's another priority question. Remember, take the intimidation out of these priority questions. It's just another way of you proving that you are competent enough to become a nurse. You deserve to become a nurse, practical nurse, registered nurse, and beyond. They want to make sure, the NCLEX is there to make sure that you are competent enough to take care of the people that need you the most. Remember, I have 25% off on my tutoring and coaching services. You can find out more about my notes on Etsy, Fulfill Your Purpose, and TamikaSChambers.com. Take care, you guys. You got this.